Hi, everyone. Welcome. My name is Morgan Zients. I'm the Senior Product Education Manager here at Jotform. Welcome to 3 Ways to Digitally Transform Your Healthcare Practice. Very excited to be speaking with you today. I want to give you a few notes about the platform we're using before we move forward into the webinar, and then I have an agenda and a couple of other slides. So we are using this new platform to us. So if you've joined us for webinars in the past, you might see things looking a little bit different. You will continue to see me in this box throughout the session, slides in the middle of the page there. And when I go out into a demo, that will take over your whole screen. In addition to that, you'll see resources related to this event in the box underneath my picture. So if you want to access the case studies I'll be talking about or look at anything else we're providing about healthcare practices, feel free to click on those at any time throughout the session. Also, anytime you'd like, if you would like to learn more information about Jotform Enterprise, there is a box on the right-hand side of your screen where I think all you need to do is hit a send button. That will get you in touch with our team immediately, and somebody will reach out to you shortly. And you can share questions underneath the presentation in the Q&A box. We'll have some live time for questions at the end. And my colleague James is on the line with us today to answer some of your Jotform questions behind the scenes as well. I believe that is everything with I also wanted to mention that you can minimize or maximize or move any of those. That won't affect anybody else's experience. So if you want to focus on one thing or another, feel free to go ahead and do that. And without further ado, let me go ahead and jump out into our session. All right. So first things first, I wanted to share our agenda for today. Today, we are going to look at 3 areas where Jotform Enterprise can transform your healthcare practice, including some examples of how healthcare providers, maybe just like you, are already using Jotform to do so. After the slides, I do have a demo, so I'm going to be demoing a couple of different features and products within Jotform that align with what I'll be talking about today. So that is our agenda, and again, we do have some time for live questions at the end as well. Okay, and jumping out into our content. So for those of you who are new to Jotform Enterprise, we are a no-code digital platform that helps healthcare providers, among others, superpower your data management. From collecting e-signatures and insurance information to storing personal patient information and health history records, and even safely exporting that data that needs to be shared, Jotform has you covered. And obviously, when it comes to healthcare, really for anything, data protection is important, but maybe especially so when it comes to patient records. Jotform Enterprise is also a perfect solution in that respect as well. Our platform includes features that enable HIPAA and SOC 2 compliance. With our HIPAA features, form submissions are encrypted when they are in the system, as well as when they're transported into the system or out of the system. So that means that patient data is always safe with Jotform. Data is also stored in a local data residency center. So all of this means that you have control over who has access to your forms and the form data, as well as that you can easily conform to any security or compliance regulations that you might be bound to. So I mentioned today that we're talking about 3 ways that you can digitally transform your healthcare practice. And the first thing I'm going to be talking about is with your patient onboarding. This is something that Jotform Enterprise can help transform in your day-to-day lives. Patient onboarding is obviously one of the most fundamental pieces of providing care. It's kind of the first thing patients learn about your practice in a lot of cases. But if you have a fully paper-based or mostly paper-based system, that can be inefficient and time-consuming. There is room for human error, and this can all lead to expensive delays and wasted resources. On the patient's end, it can be incredibly frustrating to fill out paperwork by hand. I share this story a lot, so if you've attended other webinars where I've spoken, you might have heard this anecdote before, but when I started at Jotform, I had to switch insurance providers and see multiple new doctors, and most of those required me to fill out the same paperwork by hand. It was incredibly frustrating. The last one, I almost had a meltdown and almost caused somebody on the office staff to have a meltdown as well. So it is, and I was an able-bodied patient. You may have patients that have arm injuries or arthritis, or patients who are visually impaired, for example. And for them, it might even be impossible to fill out paperwork in person. On the administrative side of paperwork that somebody submits by hand then needs to be entered into at least one patient portal or patient database, meaning that there's opportunity for human error, and that also gives administrative staff and doctors, everybody involved in the organization, less room to focus on the patient experience. Printing can also be expensive. We have a study linked at the bottom of this slide. Sorry, just realized I'm not on the right slide here. So let me get over there. There we go. That probably makes a little bit more sense. And I do see that we have a question about the recording. Yes, we will be sharing that after the event as well, just to let everyone know. So this will be available for you to watch at any time. So going back to my slide here, printing paperwork can also be very expensive. We have a study linked at the bottom here from a number of years ago that showed that the average 1,500 bed hospital prints more than 8 million pages monthly, and each printed page costs about 4 cents, which leads to almost $4 million annually. Now, obviously, that might vary depending on pricing these days. It might be even more expensive now, and will vary depending on the size of your organization. But the point is that printing things adds up. The cost of that adds up. Jotform Enterprise allows healthcare providers to significantly reduce those costs by easily converting your static PDFs into dynamic digital forms. That means that you can prioritize patient care and provide a better experience all around, as well as reduce risk of human error and that cost of printing. Healthcare practices may even consider combining onboarding. Would have made my life a lot easier when I was filling out all of that paperwork, I know, and creating a shared signing process to create a seamless patient experience. With Jotform, you can even track that process of signing things and getting paperwork prepared from start to finish. The patient onboarding and signature process is one of the things that I will demo in our demo at the end of the session or after the slides here. But in the meantime, I did want to move over to a couple of the testimonials that I mentioned that I'd be sharing throughout the presentation. So the first of these is from Body Brave. This is an organization that's focused on providing accessible eating disorder treatment. And they were looking for a way to consolidate a pretty complicated onboarding process that involved 5 different platforms they were using. They came to Jotform Enterprise. They were able to eliminate those 5 platforms and transition everything into Jotform, really completely streamlining their onboarding process. In the first 6 months, they saved 120 hours of work, and they're saving over 5 hours on average on a weekly basis moving forward. If any of you work for or with nonprofits, you may know, of course, that nonprofit organizations are often running on really lean resources, financials, as well as staff. So saving almost 1 full workday per week frees up a ton of time in this case for somebody to be focusing on better serving their clients and the organization as a whole. Another example here is Honor Health Network. They are a fairly large home health care agency that serves 8,000 patients weekly and specializes in community engagement and quality care. Before they digitized their process, their patients would have to receive a PDF from somebody on staff, print it out, fill it out by hand, take a picture of it and send it back, or some were even going to a local library to fax their responses back. So it was a pretty cumbersome process for everybody involved, but they now have over 500 forms available in Jotform. So their entire process is now digitized, and these forms are ready to share just with the click of a button or the enter of an email address, making things considerably easier, both on the administrative end as well as on the patient end. In addition to that, Honor Health Network integrates Jotform with their patient database. So there's no need for people on their staff to have to go and duplicate that data entry piece. The data moves seamlessly from what they've collected to their patient portal. All right, so the second way that you might want to think about digitally transforming your healthcare practice would be in the marketing and sharing of your practice. Establishing a healthcare practice from the start is probably very exciting, but also daunting. If you're not establishing from the start, you may be thinking about new ways to revitalize and get new patients into your office. And a digital marketing approach allows you to reach more potential patients, increase your patient engagement, and provide accessible health information to patients easily which can all come together to improve brand awareness, so your organization's awareness, and patient buy-in for your practice. Jotform Enterprise can support you through this as well, from creating contact forms that you can share anywhere, building and managing patient mailing lists that can be integrated with your favorite email marketing platforms, and even creating an appointment scheduler with our native appointment field or Calendly can all be done really easily within our system. We also recently rolled out an AI agents platform, which I will be demoing briefly as well. You can use that to support patients 24/7 and have that available online whenever patients need it. These agents can be trained to answer probably your FAQs, including helping people book appointments and walking them through their other onboarding paperwork. These agents can also talk to patients over the phone, answer questions online with a chatbot, and even text patients with WhatsApp or Messenger. Having an agent there to answer these routine questions means that patients have easy access to getting those FAQs answered, again, with 24/7 access to an agent. But that also means that if your agent is handling those questions, that means that the people on staff have more time to, again, focus on the patient experience, focus on providing a good, strong experience and helping make the organization run more smoothly overall. Here we have another user example. We have a nice quote from the CEO of One-to-One Health on the slide here. This is a Tennessee-based health system that adopted Jotform to minimize the amount of paperwork that they were processing and really leverage their customer experience. And they found that they were able to expand their reach, the reach of their organization and the number of people they were able to serve by being a digital forward organization. I think we're finding that digital forward is the way to go in a lot of cases. Providing a solid patient experience and an easy feedback loop increased their patient engagement and again, gave them more of a touch point, more opportunity to connect with patients and find out how they could better serve the patients that they were working with. Okay, our last topic here is improving access to care. Undergoing a digital transformation for your organization can also help you improve the way patients access care and how they can access that care. The use of digital tools has risen dramatically over the past decade. We have a survey from 2022 linked below here. This was an AMA survey of over around 1,300 physicians, and it found that the percentage of physicians using telehealth and virtual visits grew from 14% in 2016 to 80% in 2022. Now, of course, in the middle of that was COVID, so we saw a significant uptick in all things digital due to COVID. But like in many areas of life, we are seeing the ongoing benefit of practices that we were forced to adopt under those circumstances, one of which is access to appointments for patients who can't make it into an office. The survey also found that the percentage of physicians who feel that digital health tools are an advantage for patient care grew from 85%, which was already very high in 2016, to 93% in 2022. So in short, in summary, the use of digital tools has grown significantly. It will continue to do so, and a heavy majority of practitioners are finding that that's a valuable improvement for their patients and for them and their staff as well. Our final customer example here before we go out into the demo, here we have United Way of Roanoke Valley. They are a social services organization based in Virginia, and they are using our mobile form capability to be able to collect data for a health equity study, among other things, across a vast rural network that they serve. They've been able to create real-time reports based on zip code to track participation rates per region and be able to quickly and easily find out where they might need more to up participation, as well as to increase services. Their community healthcare workers are using Jotform's mobile capabilities so that they can spend more time in the field working with more people. So this is another example of the versatility and the power that you can have when things are available to you digitally, when you are using digital tools. I do want to put in a quick plug here before I go out into a demo for our healthcare digitization. That is a very hard word to say. Healthcare digitization and automation basics course in Jotform Academy. It is linked in your resources on the left-hand side of your screen there. That course is about an hour with a quiz Once you complete it, you can earn a certificate. And it kind of expands on what I'm talking about here today. So if you would like to learn more at any point, we do have that course available to you as well. Okay, so now I'm going to go out into Jotform and give you a demo of some of these tools that I've been talking about and talk a little bit more about how these can be useful for your organization. So let me go ahead and share my screen. We're going to see a little bit of a time loop here. Hopefully now you see my screen. Okay, so I am starting the demo here, logged into my Jotform account, my Jotform Enterprise account, and I'm on my Workspace page. This is what you see when you log into Jotform, and from my Workspace, you can access any assets that you've created in Jotform, as well as create any assets from here. I am going to show 3 different things in this demo. So the first thing I'll show, just want to make sure I'm not, okay, looks like I'm on the right. You can all see my screen. The first thing I'm going to show is how to take a PDF that you already have available and easily transform that into a form. Then I will show you the examples, the 3 things that you see here, they're all tied together. So it's an example of a form that has a workflow included in it that links to another form. And then the last thing I will show you briefly is how to set up one of our AI agents. So 3 things that we'll be covering. So back to the platform here. So again, we're logged in on my Workspace. Again, here we are seeing all of the assets that I've created in my account, but since Jotform Enterprise is meant to be a shared environment versus our individual Jotform user plans, you can access your teams here on the sidebar or over here with the dropdown right here. And if you click on any of those, you'll see all of the assets available for your entire team, a team that you sit on. In addition to that, you'll notice from the dropdown here that I can navigate from my Workspace to just a particular type of Jotform asset. So if I just want to see my forms, for example, I can click on that and come to a page where I have all of my forms available for edit right here and can create a new form from here. And I am actually going to get started here. So if you are creating a form in Jotform, you want to go ahead and hit that button, and then you'll see that you have several options to get started. So first, you can create from scratch, completely blank slate, just drag and drop fields where you want them, customize colors, branding, etc. You can also use a template, and the other example that I'm going to be showing, the second example, does use one of our templates. You can come in here. There are categories of types on the side, as well as browsing by industry or profession. So you can search for browse for relevant forms there, or you can come up to the top and search using a keyword or words. So I searched patient intake here. I'm not quite sure why it's showing 0 results listed, but there are, as you can see, a number of results here. So if you see a template that seems like a good fit for something that you want to create in your account, you'll click Use Template. That will clone a copy of it into your account, where then you can customize it however you need without affecting the template itself. It will just affect your version. So very easy to do, very easy to get started if you don't already have a form that you're using and don't want to have to start from scratch. These templates come in really handy. And if any of you are working with other organizations or other things where Jotform might be useful, as you can see, we have over 10,000 templates. So there are tons of them available to you to look through. Next here is Smart PDF Forms, which I'll come back to in a moment. We also have the option to create e-signature forms, and one of the forms I'll show does have an e-signature included in it. And then finally, import form here. If you have a form in your account already that you would like to clone, you can do that under import. Or if there's a form on a website that you want to pull in from the website, you can do that here as well. But again, let's first look at starting a PDF. I wanted to show this example because for a healthcare organization, you more than likely have a PDF or PDFs that you use that you might want to digitize if you haven't already done so. So I thought this would be a very relevant example for this audience. So I'm going to come here and I'm going to find a form that I found online, just a general patient intake form. What this feature is going to do is when this is done processing, it's going to turn this turn this PDF version of a form into a form that would be super easy for a patient to fill out. and super easy for them to go through, but also you will still have access to it in the same PDF format. So there's no need for you to worry about creating a whole new format or anything like that. There's no need for you to have to start from scratch and manually transform fields from a PDF into a form. It will do all of that for you. Takes just about a minute there, depending on the length of the form. This is a fairly long form with 5 pages and a bunch of text, so it took a little bit longer. But now that it's in here, you can see all of the, you see the form on the left and the PDF, the original PDF on the right. When you click on a field in the form, it will show you what that maps to in the PDF. There might be some changes you need to make. So for example, here we have a singular name field that's only linking to first name here, and the last name field is coming up blank. You can easily edit that. To edit any field on the form, as you can see, I have clicked on it right here. So there is a remove option, trash can, or properties here as well. And if you move anything around, you can also very easily, again, move these fields as well. Just tell it what it should tell the form, what it should map to in the PDF. So you can see the whole form here. The PDF has been turned into a form. The whole thing is here, all of the text, etc. If we go to the Publish tab, this is where you have all of your sharing options for the form. So you can share by link, email, QR code, whatever it is that you need to do. And if we open this in a new tab, we can see this from a patient perspective. So the patient would receive this form. They would see this page. They can hit Start Filling. And you can see that they're then asked to fill it out as a form rather than the small text of the PDF. So let's just pretend I filled out this whole thing. I get to the bottom and I sign here. I can then preview the PDF and see what that looks like. And again, you on the staff or the doctor's end will receive it in this format. Again, this field didn't come in exactly right, but we can see, pretend all of the data has been included. It's still in that same PDF format that you have available already and are used to looking at. And then the patient can also, they go back to form and can submit from there. So again, this makes things very easy. You can use a form, PDF that you already have available that you're already used to, and very easily transition that into a form that is useful for patients, easier for them to go through and fill out. Okay, I'm going to click the Jotformers logo here to go back to my landing page. Now we can see that new patient intake form has been added here. And for my next example, I'm going to talk about workflows and how you can send a form through a particular process in Jotform without having to have any manual intervention involved in that. So what we have in this case is a telemedicine request form. This is a relevant but probably not super realistic example. I'm assuming in this case that somebody fills out a request, an intake form, and that is ultimately going to lead them to an appointment scheduling form. So we can open up this in our form builder by hitting Edit Form. And the form builder is where you can build your form from scratch as well as make any edits. So it looks very, just like what we were just looking at. Any elements you want to add are on the side. You can drag and drop to put them wherever you want, delete to delete, and then each field will also have properties for that field. As for design, you can see there's an add a logo option at the top, and there are colors, themes, etc. over here. Again, that Publish tab is where you'll go to share the form. The middle tab, Settings, is for the things that happen more behind the scenes on the form. So things that patients won't necessarily see, but that are also very important to the form, like conditional logic you might want to include, integrations, again, with your patient portal or cloud storage or whatever integrations you might need, email marketing platforms, and then among other things are workflows. If you don't already have a workflow included, you'll see an option here to create one. Since I have created one in this case, I'm going to hit the pencil icon to bring it up in the workflow builder to edit it from here. And here we have the workflow builder. When you first get started with a workflow builder, this is blank. You can create, again, just by dragging and dropping whatever you need to add to the workflow and then connecting it to the next piece. And this workflow, what this is saying is that when somebody submits a form, the first step of the workflow is a condition where if somebody has checked a box indicating that they're experiencing depression and anxiety symptoms, we're going to assign a task to somebody on our staff to get in touch with them. We want to make sure that there's not a medical emergency in this particular case. As long as that box is not checked, we are sending this through an approval process where first an admin, somebody on the staff of the office is going to approve, make sure everything is filled out, or at least everything that's essential is filled out. They will approve and sign off on that. And then it will go to a doctor on staff for approval. Again, probably not the most realistic example, but I did want to illustrate a number of the different features that you have available here, including the option to send this through multiple levels of approval. So then let's say the doctor will approve, say everything looks okay. Once the doctor approves, the patient will receive that appointment scheduler to schedule an upcoming appointment. If the admin approves, let's say an essential field is missing, or a doctor approves, maybe this isn't the right clinic for them, then they're getting an email saying, please reach out to us so we can discuss why we're denying your request for an appointment, something along those lines. So again, a number of different things here. So we have a task assigned, we have emails as an outcome to patients, we have a form going out to patients if everything looks okay as an outcome. All of this happens with no human intervention. Nobody has to manage this process. So the system is automatically reading that field for whether or not that box is checked. If it is checked, then somebody on the team will be notified to reach out. If it's not checked, then the admin will be notified to approve. When the admin approves, the doctor will automatically be notified to approve. And when the doctor approves, that appointment form will automatically go out to the patient. So this can save a ton of manual time and effort. I know with patient onboarding, there are often multiple forms involved in that. So you can set this up to just sequentially get people through all of the new patient onboarding paperwork. So again, your staff doesn't have to send anything out, follow up with people. All of that happens directly within the system. Okay, so once again, clicking that Jotform logo to go back to my home, I did just want to quickly summarize those first two before I go into AI, since AI is a little bit of a shift, but we looked at how to create forms, and among those is the option to create from PDF. All you need to do in that case is upload a PDF you already have available. The system will create a form from there. You might need to make some small changes, but otherwise pretty much ready to go. And then also to any form that you have, you can add a workflow. And again, there are multiple different pieces, outcomes, et cetera, that you can add to those workflows. That can be as simple or as complex as you need. All right, so our last example here is our AI agents. And again, this can be really useful with interacting with patients and serving as frontline communication, saving the people who typically answer the phones a lot of the energy of having to answer questions about hours that you're open or whatever other FAQs they're typically answering. And again, this is available to patients 24/7 in a variety of different formats. So first things first, you'll select what channel you want to create an agent for. This doesn't really matter. You can always adjust this down the line. So let's just say standalone for now. From there, you have a number of different choices. So you can start from scratch and build your agent from the ground up. Again, we have templates for agents, and there are a number of health-related templates for those. You can clone yourself in the knowledge that you have, or if you have a form that you want directly served by an agent, you can start with that form. I'm going to start from scratch in this example. The first thing that you need to do if you start from scratch is just give it a brief description of your agent as a prompt. So let's say a friendly but professional healthcare agent to answer patients' FAQs and guide them through paperwork. And then I'm going to go ahead and hit create. So that prompt is going to give you a general design for an agent. You can see it takes a couple of seconds here. Once that is ready, any of what it creates can be edited, but you're giving it just a little bit of a starting point. And here we can see our Clara healthcare support agent. Friendly, kicks off with a friendly question. How may I assist you today? This is what this looks like as a standalone agent. There's a chat bot and then also a voice option as well. You can add a welcome page if you'd like here. This is all in the build tab. There's also general settings here for what that will look like. And then also some design options over here as well. So if you'd like to change what Clara here looks like, you have all of your different agent choices or choose your own, upload your own images, etc. Again, the Publish tab here is where you'll go to make your agent available. So that can include sending this out by a link or email. Most importantly, though, probably, because I'm imagining that this might be something you want to add to your website, again, to answer those FAQs, there is embed code at the bottom here. You have a number of different embed styles. And then also on the side, you'll see other options for how you can embed and share different types of agents. The Train tab is probably the most important part of agents. This is where you're going to give your agent the knowledge that it needs to answer those questions. So all of these tabs here all relate to giving the agent the tools it needs to answer questions. Under Persona, you can also change a little bit about how the agent works. So here you can also change name, you can change its role, default language, tone of voice from friendly to professional, for example, and the length of responses it will give. I think in this case, a short response, something concise to give back to patients is probably the best option for me. But if you want your agent to be able to provide longer, more detailed responses, you can go all the way up to chatty as well. In this knowledge base tab, you have a number of different ways to add knowledge. So you can do that by text. You can add a link like to your URL, for example. You can upload files, and you can also answer, give it specific questions to respond to. So let's say we want to add in our open hours. Monday through Friday, 9 a.m. to 5 p.m., closed for lunch. We are also open Saturday. So I've given it just some general information to get started here. Once I've added that, I'll be directed back to the previous page where I can add any new knowledge that I need to add. So let's say I want to give it the specific question. You offer allergy shots on my brain this week. I don't know if anybody else is experiencing insane allergies, but yeah, it's been a rough week over here. So allergy shots on the brain. We have a shots clinic open from 12 to 3 p.m. each day. Sign in when you arrive. So again, I've added a different type of information. Again, I can continue to add whatever knowledge I need there. We can also set up actions as like conditional logic. So if something happens, if a patient enters one thing, the chat bot, your AI agent will respond another thing. We can integrate our agent with other tools, whether that's within Jotform or sending data that the agent receives to cloud storage or to Slack so somebody can get in touch with them, or creating appointments directly from here. We can integrate other forms as well. So if we want the agent to help guide somebody through a form, we can come here and add a new form. And let's say we want this agent to be able to help make appointments. We can add that in. That way, if somebody says, I'd like to make an appointment, the agent can guide them through this form by asking them questions. And then you can also train your agent with chat here at the bottom. So this would be as if you were a patient chatting with them, and then they'll give you the responses, and you can adjust the knowledge that you've given your agent accordingly. Okay, and again, last thing is when you are ready to share your agent, when you've given it all the knowledge it needs, you can go ahead and get that embed code here, or your other options for sharing here as well. All right, so that is everything that I wanted to demo today. So again, chose 3 things that I thought would be especially useful for healthcare organizations for a variety of different reasons, especially working with patients and making things easier for patients, as well as everybody on your staff who might be receiving paperwork or working on a paperwork process. Let's go back to slides at this point. Apologies for that infinite loop. And last thing I'm going to do here is just sort of summarize some of those resources that we have available. And I don't see a ton of questions, but we do have some time for questions if anybody has any. So if you haven't shared a question already and you have one, please feel free to go ahead and enter that into the Q&A box that you see. Okay, so yes, okay, I am on the right side here. So again, just wanted to summarize the resources that you have available here in the side there. And again, we will be sending all of this out after this session as well. So when you receive a link to the recording, you'll see it in the same format you see it now, all of those resources will be there as well. We have those, a number of case studies, the Honor Health that I mentioned, One-to-One Health and United Way of Roanoke Valley. So you can read those in a little bit more detail about how these organizations are using Jotform to improve their digital presence. We have our healthcare digitization and automation basics course that I mentioned. And then we have a one-pager and a white paper available to you with a little bit more information as well. That one-pager also includes the case study about Body Brave. So yeah, check those out at any time. Okay, so I do see a few questions, and I'll just put up my Q&A slide to close this out here. Is the AI agent intuitive? So you do need to give it all of the information that you want it to share. So it doesn't have knowledge unless you give it the knowledge. From there, it should respond to questions with the knowledge that you've given it. So it should, be able to respond to any any questions that come in. So that's again why I thought like an FAQ might be a good example and a good use case. You can easily import whatever information you already have available, those questions that you get asked all the time, free up that staff time, and take it from there. But yes, you do need to manually add all of that information. That could be as easy as, again, sharing the FAQ page that you already have on your website, linking to that, and it can pull it from that information. So a couple of different things there. I did also mean to mention, if you would like to learn more about our AI agents, we have a more broad, detailed training for that every 2 weeks. If you would like to check that out, feel free to drop your name and email into the Q&A, and I'll follow up with you directly and send you a link to our next live session for that. Okay, let's see. Okay. Sean, I do see your question. I can't send the email with the pre-populated info in the 2 box. I'm not sure where you're referring to. So if you want to, if you can clarify, I can try to come back to that question. Okay, so Brandy is asking, we use Jotform and we love it. Thanks, Brandy. I'm glad you like Jotform. If we didn't start out with a PDF to create our new patient form, is there a way for Jotform to create one based off the form we created it with? There is, yeah. So let me go ahead and share my screen again. You're going to get that infinite loop again for a moment. When you are in the form builder, so this is my telemedicine intake form here. You can read patient responses as a PDF if you go to PDF editor. And all of this happens automatically within Jotform, I should mention. So any of your data management, all of the the tables, I didn't really talk about those, but all of your data is collected into a table when somebody fills out a form. So that looks like this. There's no data in it currently. I'll give it a second, or one response in it. But this is created automatically. This would eventually be a database of all of the responses to this form. There's also Inbox, which is like a native email built into the platform. So you can see each response in an email format. And I meant to show this when I was talking about signatures. So actually, I'm glad I remembered to come back here. If you do have a workflow process in place, you'll also see that here in the inbox. So we can see here, this is waiting for the doctor's approval, but it's already been signed by me, the admin. Same thing in tables. Let me just go back to that briefly. In tables, you'll see that flow status column. So you can track any workflow in these other tools as well. But to go back to the PDF question, when you create a form, the system will also automatically create a PDF version of that form that you can then edit however you need. So this is the form response as a PDF. You can, and you can see the flow history is included here as well. If this does not look exactly the way you want it to, you can edit any of this as well. You can customize design, you can add and remove fields, etc. You can add your logo, whatever the case may be. So if you do want it to look more like the PDF that I showed you originally, you can add all of that in. But if this is enough for you, this is created again automatically. It can be customized however you need, but yes, all patient responses are available as a PDF. Okay. I see Stacy is asking if Jotform can be integrated with our current practice management system. So that depends on the system you use, but let me share my screen again, and I can show you where you can find all of that. So we go back to my form builder to look at this form. And I go to settings and integrations here. All of our integrations are available on this page, so you can see what's available. There are over 100 integrations. We also integrate with Zapier. So if it's something that isn't available natively, Zapier can also often be like an intermediary. And if you don't see something that you need, you can always request an integration that will go directly to our development team. So no guarantees that they'll create that right away, but they will directly receive that. So if you are looking for something, if they get enough requests for something, that will, that is added to their list. Right. How do you access the digitization course? And I can see that James is responding to some of these questions as well. So I'm going to try not to overlap here. To access the digitization course, it should be in the box under where you see me currently is the list of resources. It's, I believe it's labeled course, healthcare digitization and automation basics course. That will take you directly to the landing page for that course. And you can, you just need to sign in with an email address, basically a Jotform user name or email address. Pretty easy to go through from there. You watch, the videos are about 5 minutes, 6 minutes. I think there are 6 of them in that course, and then there's a quiz at the end. So when you complete the whole thing, including the quiz, you'll earn a badge or a certificate in that. Okay. Sorry, I'm trying to look through questions, and again, trying not to overlap with, yes, okay. Just trying to check all the questions here. Okay, I see a few people who are interested in the AI training. Great, I will get in touch with you. As I mentioned, I'll reach out to you today with the link to the next session. So unfortunately, the most recent AI Agents 101 overview is right now, but the next one will be in 2 weeks. So again, I'll get you all the forms for that, anybody who has shared that. And I think we've gotten through, yeah. I do see, Sean, your question about EHRs. I'll ask somebody on our team to reach out with you directly about that. And I think we've gotten everything else. I think between the questions that I've just answered live and the ones that James is responding to, I think we've gotten you all. If I have missed a question as I'm going through these, please also feel free to email me directly. I may not be the best person to answer your question, but I can get you in touch with that person if it's not me. I'm Morgan at Jotform, Morgan at Jotform. Again, those of you who've already asked to get the link, I will send that to you. No need to follow up with me. But if there's something that I've missed here, or you think of something after this session, do please feel free to get in touch with me. You should, again, receive this recording, I believe, later today or early tomorrow at the latest. It takes a few hours to process, but On24 will automatically send that to you. When you receive that link, that will take you back to a console that looks just like what you're seeing here. So you can still access those resources. You'll still have the get in touch with us box on the right. And again, any questions at any time, reach out to me, Morgan at Jotform. Thank you all so much for joining me. This was our first time using On24, so I had a little extra anxiety today. So thanks for bearing with me. I hope everything worked okay. And hopefully I'll see you at a future webinar. Thanks for joining, and have a good rest of your day. Bye.